I'm Thurl Cledera, and I finished my diagnostic radiology residency at St. Luke's Medical Center, Global City in the Philippines, and I am continuing further fellowship training in cardiothoracic imaging with a focus on cardiac imaging at the Toronto General Hospital University Health Network through the University of Toronto. I was invited on this project by Dr. Diane Flores, who is my mentor, and an assistant professor at the University of Ottawa, and I staff musculoskeletal radiologist at the Ottawa Hospital. We recognize that most of the current literature focuses mainly on imaging findings and complications following reconstruction of the anterior cruciate ligament, and there is comparatively limited discussion on procedures involving the other stabilizing structures of the knee. Reconstructions of the posterior cruciate ligament, medial cruciate ligament, and complex regions such as the posterolateral corner remain relatively underrepresented in radiologic literature. Recent novel surgical techniques have been developed for these structures, and there is a lack of a unifying resource that would help guide the general radiologist in interpretation and reporting of post-operative imaging for these structures. I learned that the goal of an educational exhibit is to not only showcase high quality and illustrative cases, but to also emphasize key learning points that can be directly applied to clinical practice. The concept of our exhibit had already been established in advance. Given Dr. Flores' extensive experience in publishing educational reviews, she had already accumulated a large number of post-operative knee images and had been contemplating this topic for quite some time. Given the strong case foundation of our exhibit, my primary role focused on ensuring that the imaging findings, surgical techniques, and learning points were accurate and up-to-date. Our goal was to review and synthesize the current literature in order to provide a guide that shows useful context, highlights evolving surgical techniques, and provides a guide for interpretation and reporting of post-operative knee imaging for the radiologist. After receiving solicitation, the manuscript writing process was relatively straightforward. The overall structure of our article was already established to our exhibit, which serves as its backbone. Our paper largely reflects the content of our exhibit while allowing us to expound on the surgical techniques and provide up-to-date evidence from the literature. The most challenging part of the manuscript writing process for me was determining how to present the information in a useful way for both the experienced radiologist and trainee. With guidance from my mentor, I was able to balance learning points and provide concise explanations for the surgical techniques and anatomy. To further improve our article, Dr. Flores had invited Dr. Tatiana Cantarelli, an eminent musculoskeletal radiologist, also from the Ottawa Hospital, to provide a second set of eyes for our paper. Her review ensured that our paper was accurate and clinically relevant. Having the opportunity to contribute to this publication has opened doors for further academic opportunities and advanced training. It has also given me the confidence to create and develop educational exhibits independently. I have gained skills in identifying clinically relevant topics and writing reviews that are both practical and grounded in current evidence. Through this process, it has strengthened my interest in academic radiology and contributing educational materials that are both useful for trainees and practicing clinicians.